Hey there, healthcare professionals! Welcome to a deep dive into the fascinating world of child and adolescent psychiatry. All right, let's break it down. Child and adolescent psychiatry focuses on diagnosing, treating, and managing mental health disorders in young people. It's a specialized field that requires understanding how mental health issues manifest at different stages of development. So, let's explore that. First up, developmental considerations. Kids and teens go through major changes that affect how mental disorders show up. For pre-adolescents ages 6 to 12, they're developing their sense of self and understanding of their environment. Disorders like ADHD and autism spectrum disorder are often identified here. Take ADHD, for example. It might look like trouble paying attention in school or acting out. Now, for adolescents ages 13 to 18, this period is packed with puberty, social, emotional, and cognitive changes. Disorders like depression and anxiety become more prominent. A teen with depression might show irritability and withdraw from social activities. Sounds like typical teenage angst, right? But it's crucial when these behaviors are persistent. Next, let's talk common disorders and their presentations. ADHD is characterized by persistent inattention, hyperactivity, and impulsivity. In kids, this might look like difficulty sitting still or following instructions. In teens, it could be chronic disorganization and trouble managing responsibilities. Autism spectrum disorder, or ASD, involves challenges in social interaction and communication. A child might struggle with making eye contact or understanding social cues. An adolescent might find it hard to form friendships or grasp social norms. Anxiety disorders include generalized anxiety disorder, social anxiety disorder, and specific phobias. For instance, a child with GAD might excessively worry about school performance. An adolescent with social anxiety might avoid social situations due to intense fear of judgment. Mood disorders like major depressive disorder and bipolar disorder are also critical. A child with MDD might show irritability, low energy, or changes in sleep patterns. An adolescent with bipolar disorder may experience extreme mood swings, including depressive and manic phases. Conduct disorder and oppositional defiant disorder. Conduct disorder involves severe behaviors like aggression and rule breaking. ODD is characterized by defiant and oppositional behavior. For example, a child with conduct disorder might engage in physical fights, while a child with ODD might frequently argue with authority figures. All right, moving on to assessment and diagnosis. It often involves clinical interviews, behavioral observations, and sometimes standardized testing. Gathering info from multiple sources, including parents, teachers, and the young patient themselves, is key. Clinical interviews help clinicians understand the child's history, symptoms, and impact on daily life. Behavioral observations across different settings provide insight into how symptoms manifest. Standardized testing tools like the Conners rating scales for ADHD or the Autism Diagnostic Observation Schedule, ADOS, can be invaluable. Now on to treatment approaches. Psychotherapy, especially cognitive behavioral therapy, is effective for anxiety and depression. For example, CBT might help an adolescent with social anxiety learn coping strategies. Medications can also play a role. Stimulants for ADHD or antidepressants for depression might be prescribed, often combined with therapy. Family therapy is crucial, especially for disorders impacting family dynamics like conduct disorder or severe mood disorders. School-based interventions are beneficial too, particularly for ADHD or learning disabilities. Collaborating with schools can provide necessary accommodations. Lastly, challenges and considerations. Stigma around mental health issues in kids and teens can impact treatment seeking and adherence. Treatments must be age-appropriate and tailored to the developmental stage. Coordination of care often involves various